Hi viewers, welcome back. In today's video, we are going to discuss about umbilical sepsis or omphalitis. Okay, so umbilical sepsis is the infection of the umbilical cord. It is also called as omphalitis. Okay, so when is this happening and why does this is happening? Okay, so when a newborn baby is delivered, the baby will not have any complications, that is most probably, unless and until if the baby mother is having an infection, and sometimes when it is traveling through the birth canal, at that time it can happen, or otherwise it is because of the microorganism once after the birth of the baby, when the baby is getting exposed to microorganism. So when the baby is getting delivered in an unhygienic place, or where the baby is getting exposed to these type of microorganism as your staphylococcus and your clostridium tetani. So these are a very infectious organism which is going to cause sepsis to the umbilical cord stump. Okay, so the clinical features, how does the baby present with? Okay, so first is a serous or a purulent discharge. So the normal umbilical cord stump, how does it look? So when you are assessing the umbilical cord of the baby, it has to be dry, and day by day it has to dry up, and maybe within 1 week or 10 days it will fall down by itself. Okay, you need not do anything. So usually when we are there in the hospital, usually the mother, when she is getting discharged, we always tell the mother that you are not supposed to apply any oil, no chemicals, nothing you are supposed to apply over the umbilical stump. It has to be kept dry. Okay, after giving bath you have to wipe the area with the towel, and that area has to be clean and dry. Only that much is sufficient. So it will fall by itself. You need not give any special care to the umbilical cord stump. Unless and otherwise, if the mother is not having an clean environment, even if the hospital, if it is not clean and clean environment, if doesn't possess, then definitely there will be an omphalitis. Okay, so usually the child will have a serous or a purulent discharge. So usually there will be a mild discharge, maybe within 1 or 2 days there will be a mild discharge, and sometimes it will become little more thicky discharge. Okay, so it will become a cloudy appearance, like that it will be present. Maybe with few days, like within 4 or 5 days, it will become pus discharge, like you will get pus from that wound also. Okay, and then we have the periumbilical skin redness and swollen. What is the periumbilical region? The umbilical cord, you have the region which is surrounding the umbilical cord, so that we say it is the periumbilical cord region. Okay, so that region, how it will appear, it will be red and swollen. Already there is an information, you know, redness and like when the area is getting swollen, they are the indications of inflammations. Okay, so the periumbilical region is red and swollen. And then we have delay in falling of the cord. So I said, like within 1 or 10 days it has to fall by itself. So in case if it is not falling, then you have to have an understanding that the child is having omphalitis and the child is getting delayed in falling of the cord. Then we have pyrexia. Pyrexia is nothing but increase in body temperature. You know, when the child is having an infection, definitely the child will exhibit pyrexia. Okay, so there will be an increase in body temperature. And then coming to toxemia and jaundice. So toxemia is your, like the infection is spreading. See, already this body surface area of the baby is very small. If there is a mild infection also, it will spread very fast, like it will affect the whole body. Okay, so and the umbilical cord is infected, again it is a vital area. So what is happening, the infection spreads very fast, so that the child will exhibit toxemia as well as jaundice. So you can understand the treatment area will become little more complex when the child is exhibiting omphalitis. Okay, so these are the clinical features. Then the spread. So how it is getting spread? See, already the cord is infected. The source of infection was the umbilical cord. So whatever maybe the mother would not have cleaned that umbilical cord stump properly, exposure of the organism, mother would not have been vaccinated. So all these are the causes. Okay, some people they apply cow dung over that area, and some people they apply turmeric powder, and some people talcum powder and all these nonsense and all they do. Okay, so just because of all these things only the organisms get entered into the like your cord stump. Okay, so periumbilical cord cellulitis with suppuration. So the periumbilical region, so we said no, redness, swollen, and other than that the area around the cord will become cellulitis. Cellulitis is the cell destruction where there will be inflammation and there will be pus formation in that area. Okay, so from the cord it is getting infected to the periumbilical region also. The next is thrombophlebitis. Thrombophlebitis, again you know, it is the inflammation of the area where the cord is getting infected. And then we have peritonitis. Peritonitis, it is the next stage where the peritoneal layer is getting infected. So the spread has been started and it is getting infected with the, like your peritoneal layer is getting infected. So these are the complications. The spreads goes on like this: your periumbilical cellulitis with suppuration, and then thrombophlebitis followed by peritonitis. Okay, so now prevention. So prevention, as far as possible, don't touch the umbilical cord, give a bath, keep it area dry and clean, that much is sufficient. Your body will take care and the wound will heal very easily. But when you do something which is not necessary, that will infect the wound. So antiseptic preparation you have to do. So that is like, you have to clean the wound every now and then with antiseptic solutions. And then care of the umbilical cord stump. So once there is like a wound has been, like you know, it is infected, so what happens to prevent the spread? So what you have to do is, like, you have to take care of the cord stump properly. Then curative area. Curative area, what you have to do is, like, you have to go in for surgical dressing. So surgical dressing you have to provide. So you know, aseptic cotton, gauzes, everything has to be aseptic because your organism is your Clostridium tetani. So you have to be more careful. Everything has to be sterilized and a sterile wound dressing has to be done. Followed by swab culture. So you have to take swab cultures before, like you have to take a culture and then you have to rule out what is the microorganism, and antibiotics will be prescribed for that only. Okay, then systemic antibiotics. Okay, so in case if the spread has been started, if there is a like a peritonitis, so what will happen? You have to start with systemic antibiotics. So already there is a peritonitis, toxemia, jaundice and all, like everything is present. So what will happen? So you have to start with high dose antibiotic. And then local abscess, you have to treat the local abscess. So however the wound is present, you have to do an incision and drainage, and you have to drain the pus collections. Okay, so this is a small topic, and what we have discussed is an umbilical sepsis or omphalitis, where we have discussed the causes, the clinical features, the spread, prevention and the curative part of omphalitis. Okay, so with this we complete today's class. If you have any doubt, get clarified with your comments. Take care. Goodbye.